A baby's vision goes through many changes during their first year of life. So what should new parents be looking for regarding vision development? In this episode of OCuTALK, optometrist Amrit Bilkhu walks us through the development milestones of the first year, things parents can do to facilitate vision development, and signs to look for that could indicate potential problems. Dr. Bilkhu?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and welcome to OCuTALK. Today, we're going to be talking with Dr. Amrit Bilkhu with Northern Sight Optometry in Vaughan, Ontario. Hello, Dr. Bilkhu. How are you?
I'm good, Thomas. Thank you so much for having me. I really appreciate it.
Yeah, absolutely. Well, we like to start here by just giving an introduction to everyone. So can you give us an introduction to yourself, your history, your practice?
Yeah. So as you said, my name is Dr. Amrit Bilkhu, and I graduated from the Illinois College of Optometry in 2019 in Chicago. And then I went on to do a one-year residency program in vision therapy and rehabilitation at UC Berkeley. So that vision therapy residency, I spent a lot of time in that year with a lot of young children who had visual developmental delays and binocular vision dysfunction, and then children and adults with stroke or concussion and head injury from sports injuries, car accidents, and things like that. So that residency gave me a lot of empathy for people going through hard times, and it fueled my passion for pediatrics because I had a lot more fun doing therapy with the kids than the adults. So that's when I realized I definitely had a passion for pediatrics. And so now I am the co-owner of Northern Sight Optometry in Vaughan, Ontario, where I'm offering those specialty services, vision therapy services, and pediatric services, where I see infants as young as however young you want to have them and bring them in. So youngest patient I've seen is 3 months old, and I have a great time with them, and I'm very comfortable with hanging out with the little ones all day.
Very good. I think today is a very interesting topic as we're going to be talking about, pediatric optometry, but also just about vision development in children, which I think for us parents out there will really answer an important age-old question, which is, should they be doing that?
Yeah.
So I think it's really interesting. So let's talk about it. Let's start at a very high level, talking about just vision development in infants and what is the normal course, and then maybe we can talk about how that can deviate.
Yeah. And you know what? I love that we're going to talk about this because many eye doctors will talk about, the importance of having a kid's eye exam start at 6 months old and then, every year. But when you really start to research as a parent, why should I bring my kid in that early? What's really happening? And, I'm a new parent. What should I really be looking for in vision development? There's not a lot of readily available resources online, right? The CDC has great summaries for maybe motor milestones, maybe some language and auditory milestones, but vision is not really there. And so there's a lot of things that happen though with vision development from the day your child is born. So, we can kind of go right into what kind of happens with vision month by month as your child develops. And so by month 1, your baby is just learning to open their eyes and blink in response to light. So they'll see light, their eyes will start to pick up that visual stimulus and start to become activated, correct? And then they'll slowly start focusing on faces that are right in front of them. So right at about 8 inches away. And they only notice high contrast, black and white, vivid images. So they don't have any color vision yet. So hold off on the Tykes toys at that age. They really just want to look at mom and dad and maybe just some black and white pictures. And so that is the best phase for you to just start engaging with your baby, talk to them, have your face really up close with them, and just show them some simple objects, some household objects, and I'm sure they'll have a great time looking at them. When they go into 2 to 3 months old, babies are now starting to better follow moving lights or toys that are really close to their face, moving from side to side. They'll also start noticing their own hands in front of them, which is awesome because now they're starting to notice that they're a human being and that they have other body parts. So now their motor milestones are starting to kick in too. And their vision sharpens a little bit so they can start seeing about 12 inches away. 4 months is really fun because we get the onset of color vision. So go to the basement, pull out all the toys you got from the baby shower because now they're starting to notice the vibrant reds, and all those really, really bright colors. And they're starting to now reach and grasp for those objects. So this is where motor and vision start to develop almost at the same track. Before their vision was great, they were relying on their motor movements to tell them where they are in the world. But now at this phase, they're starting to see objects and their eyes are starting to tell their hands where to move those hands so that they can try to reach for those objects. So the best thing to do at that age is start to slowly inch toys a little bit farther from your baby and have them purposefully try to reach for those objects. And that's when tummy time really comes into. Tummy time is a huge milestone that would really help benefit vision development because they're starting to uphold their neck posture, which means they're also starting to move their eyes, shifting from the ground up into space. So they're starting to look at objects that are farther from the ground level, which is awesome. And then in 5 to 7 months, that's again another big step. And this is that step where we usually recommend you bring your child in for their first eye exam at about 6 months old, because now in those first 5 months, they've already gone through what we've already summarized. But now at around 6 months old, their eye muscles are starting to coordinate together. So their eye-hand coordination is starting to improve. If they had any wonky eyes before that, hopefully that should be gone. Now those muscles know where to turn and where to look every time they want to look at an object. So as eye doctors, that's the most critical part of their eye exam at that age, is to make sure they don't have signs of strabismus or an eye muscle misalignment at that age. And again, this is also where they're hopefully now crawling. And for any parents listening, I'm mentioning these milestones at the average times that they usually happen. Disclaimer, your baby is not abnormal if this happens earlier or later. If any milestone happens, it's a good thing, no matter what age it happens. As long as it happens, we're happy. But usually at around 6 months old, they start crawling. And again, that really helps them to explore their world from the ground, looking up and starting to crawl towards and to move towards objects that they want to get to. Or if they want to get to mom and dad's legs, they got to know how to get there. And so their vision is playing a huge role in crawling. Um, so those are the main first things when we get to their first eye exam.
So, if the first eye exam should be around 5 to 6 months, and certainly, and we've talked about this on this channel a lot, that a lot of parents aren't aware of that, right? A lot of parents think we'll get them checked out before they go to school, right? 5 years later. So. And we're trying to build awareness here on the channel about when to get eye exams. But for a lot of us parents, it may not be something that happens unless there's some questions, right, or some concerns. So, if baby development happens at different times, and we all know that, and I think it's very important to say that, because I think all of us as parents have gone through, one parent is crawling, yours isn't, and you think, oh, is something going on, right? But that's not the case, right? Like children just develop at different times. But is there anything that as parents we should be concerned about in terms of warning signs, right? Like if everything's developing fine, but what are some things that might be a little off that might be concerning?
Yeah, that's a great question. That gets asked a lot in the exam room. And my first answer is always, the first sign of a vision problem in a child, unfortunately, is nothing, right? A child will not complain or verbalize that they have any challenges because what they see is what they know. right? So if one eye is blurry or they have double vision and they're seeing two moms in front of them instead of one, they may just believe, well, everyone sees like this. And to be honest with you, I was 21 years old when I learned that double vision was not normal because I've had double vision my entire life. And I never spoke about it because I just thought that this is what the eyes do when you're tired, you know? So even as an adult, sometimes you still won't talk about it. Um, but there are subtle signs that parents can try to pick up on throughout your child developing. So looking at photos is great because you can possibly find an eye misalignment in any pictures. You can also see if your child has a slight head turn or a head tilt in photos, or if they're staring at the TV or if they're watching something.
What would I've never heard that before. What would the head tilt indicate?
So usually the head turn or tilt is to compensate for some double vision that they might be having. If the eyes are misaligned and one eye is pointing straight, but the other eye is pointing sideways, then if you move your head sideways, both eyes will start to become more aligned, or one eye will start to be hidden by the nose. So if your nose is blocking that eye, your brain is happy. You don't see double anymore. So yeah, it's children are really sneaky. They start to develop these habits, and then you just think, well, I see my child every day. These are just habits that they've just,
It's just a quirk, right?
it's just a quirk. But no, it's not a quirk. They're very smart kids. They're learning how to get around their visual problems so that they don't struggle anymore. So that's why I say the signs are usually silent.
That's very interesting. So, we're at 5 months now. We're still developing, right? We don't have adult vision yet, right? Or even child vision at this point. So, what's the next step? How do we continue developing as a child?
So I usually recommend for parents, the first eye exam is at 6 months old. The second one should hopefully be either a follow-up or another full eye exam at 1 year old, and then every year afterwards. Some doctors may recommend a little bit of a variation from that, but again, there's a lot that happens from 6 months to a year. And so it would be awesome to check in again at 1 year old, because after crawling, 8 to 10 months old, they are now fast crawling, right? They're running away from you. You
Right.
can't catch them anymore. So their eye hand body coordination is getting much better. They're starting to pick up toys and move them from one place to another. They're starting to play with blocks. They're starting to play with your kitchen containers once they get in the cabinets. And then at that 11 to 12 month mark is typically when standing and walking begin, right? On average. So again, it's a whole different type of body and eye coordination for walking. And they start to now search even for missing items. So their vision is starting to understand, I had a toy here and I put it in a container. Well, the toy's not missing. It didn't just stop existing. It's somewhere in that container, and I got to go visually search for it now. So there's other visual processing skills that are also developing, like critical thinking, not just, is my vision clear or is it blurry, but that brain is starting to use the information from their vision to understand what's going on in their world. So that's usually between that 6 months to 12-month mark.
So, and I know you touched on this a little bit a second ago. I think to all the parents out there, right? Like you always want to give your child a head start. Whatever advantage I can give them, I would like to give them that advantage. And it especially when it's the first child, right? How can we work with them? What can I teach them? Is there anything? The eyes are going to develop as the eyes are going to develop. But is there any way to help that, or is there anything that can be done to help that?
Yes, yes. And that is a great question that a lot of parents ask as well. Because there's a lot of information that parents can get from, books and courses and talking to other people. I truly do believe at the end of the day, we're still humans, and there is sort of this natural human instinct in us that is always going to be there when it comes to development. I truly believe that just engaging with your child and playing with them and having them physically active is critical for eye development. And that shouldn't be intimidating for parents to hear. I am literally encouraging parents to just lie on the floor and just play with their baby, talk to their baby, run with their child, bring them to the park, let them smother their hands in the mud and the dirt, and let them explore their world. Because if you don't allow them to explore what's around them, their development is going to be very restrictive, right? So they won't be able to develop not just vision skills, but other sensory skills, because all those sensory systems work together as a team. Their motor system, their auditory hearing system, their tactile system, so their touch, their taste, their smell, and their eyes. Everything starts to kind of develop together. And when you have a deficiency in one, for example, if you had a motor delay or a speech delay, same thing, vision can also be delayed from that. So I always just want to encourage parents to keep them physically active, play some sports with them, go swimming, go outside, you know, play a puzzle on the floor, just do fun, low cost activities with them. And I think they'll develop right on time.
So, when my first son was born, we've talked about 5 months, so and so forth. But now he was born not super early, but he was a little bit early. And there are certainly children that are born way early, right? How does a premature birth affect those timelines, right? Because we've been kind of talking about in general terms here. But what if the baby was born premature? Could we expect any changes in that timeline?
Yeah, right. So when babies are born premature, again, like we said, children don't have to follow a specific timeline for development, but there is a natural timeline that, the average baby goes through. And so when you're premature, everything is now semi-disrupted, right? You're not in that womb anymore. You don't have enough time in that womb to fully develop all your organs and all your sensory systems. So, premature babies, unfortunately, are often at a higher risk of vision issues just simply because of the fact that the eyes are now slightly underdeveloped and they haven't had time to even just develop within the womb. And also, like I just mentioned, even if the eyes didn't have any trouble, their other sensory systems could be delayed. They could have other developmental delays, cognitive delays, because again, the brain might not have fully functioned. And the brain is what processes our vision. So if your brain is not adequately developed, then your vision will not develop as well because your brain won't know what to do with your eyes and how to communicate well with it. So a lot of visual processing issues could happen in premature babies. And then health-wise, right? So prematurely, your blood vessels might be very weak. They might not have fully developed in the eyes, so they could be leaky. You could get bleeding and swelling in the retina, which is called retinopathy of prematurity. And so that can cause to retinal damage and blindness. And then, like I mentioned before, if the brain and the eyes don't communicate well together, premature babies may also develop higher glasses prescriptions and more blurry vision. So they could have high myopia. They could have strabismus or that eye misalignment, that eye turn, because again, the brain's just not communicating well with the eyes. So those are, again, things to look out for. But again, as a parent, I don't feel that you should be carrying that burden of worrying about all those things. As a parent, I think just the most important task for you is just to schedule those doctor's appointments, schedule that optometry visit in advance, and just make sure you bring your baby, at that 6-month mark and that 1-year mark so that we can do that job for you and make sure nothing crazy is going on and that your baby's healthy and developing well.
So in that scenario with a premature baby, your recommendation would still be at the 6 months mark. It's not as though there's we need to start earlier because they're premature. Although, as you said, you'd be happy to see them at any time.
Yeah, so I do know, I might be wrong with this, but I do know that from experience, and I have friends who have premature babies, that they follow different timelines, right? They follow either, the timeline from when the baby was born versus the timeline of when they should have been born, right? So, if my baby should have been born a month or two later, well, now I'm going to follow that milestone timeline. I would still recommend from the time they're born, I would still check in at about 6 months, even if you're counting a later timeline for milestones, just mainly for the health. We still want to check their health, and we can check all of that inside and outside with an eye exam. So even at just their 6 month birth mark, definitely bring them in.
Well, Dr. Bilkhu, this has been very interesting. I knew it would be. This was such an interesting topic to begin with. And I think as parents, as I said, when you have a child, you're concerned about everything.
Yeah, I can imagine. I'm not a parent yet, but I interact with them every day. And honestly, I can sympathize with them. Like yeah, whatever stress you went through, I feel like I can already feel it.
Oh yeah, it'll be there. Trust me. So, is there anything else that you specifically want to talk about in terms of pediatric eye care, life, the universe, everything?
Honestly, I think we went through it all. I would recommend, or actually, you know what? There's one thing that I'll talk about because I think parents listening here might have just curiosity about it. And if I can clarify it a bit, that would be nice, about amblyopia and lazy eye and strabismus. So amblyopia is the number one most concerning visual problem in children if their eyes don't develop adequately and if the brain does not communicate with the eyes as well. So, amblyopia is basically when the brain has not developed a strong connection to either one eye or both eyes due to a lack of, stimulating vision, right? When they're born and when they develop. So, if that brain is not communicating with that eye as much as the other eye, it's going to develop a preference. And so the eye that's weaker will either start to become very blurry or it will drift, right? So it'll turn out or it'll turn in because the brain just says, you know what, I don't want to use that eye anymore. It's confusing. I don't like it. Let's just kind of kick it out and let's focus on one eye. There's a lot of information about amblyopia out there, but it is the number one vision problem that can be treated and fully resolved if identified as early as possible. And it can be fully prevented if the children come in at 6 months old for their first eye exam, because at 6 months is when they're at the highest risk of amblyopia developing. Because if those eyes don't align together and the brain doesn't start developing better eye-hand coordination, then amblyopia may start. So bringing them in at 6 months will be that first detection of any signs of amblyopia and any risk of amblyopia. And if any parent out there has a child with amblyopia, there is not a timeline where they only can be treated at a certain age and then they're done. They can be treated at any age as long as it's caught and as long as we're doing the proper treatment for them. We can get that brain to start connecting with that eye again with therapy, rehabilitation, glasses wear, lots of cool stuff that we can do for it. So I just figured a lot of parents might even have questions about that.
That is absolutely good. And for the viewers out there, I believe we did a video on strabismus and amblyopia in the past. So in terms of what Dr. Bilkhu is talking about how they treat this, I think we can share a link to that here. But suffice to say, it, as you said, it absolutely can be treated. Now, I have heard through some of our interviews that it's somewhat easier to treat at the younger age. I don't know if that's just compliance, maybe. But nonetheless, I think that's the importance of getting in there, and plus, you can get these things taken care of early. It's always a good thing. So I think that would be very, very good. So, is there anything else that you want to cover about pediatrics today in terms of our little babies?
I don't think so, because honestly, I can, but as you can already tell, I will talk for hours and hours and hours about kids, and I will not let the listeners suffer listening to me talk about it forever. I think we went through a lot of great points, and if anyone listening has any questions, I'm always open to having people contact me. They can always reach me through Northern Side Optometry's contact info or through Instagram and my social media, because I think the more informed parents are, the better. And then those parents can then share that information with their mommy groups and their daddy groups and and their own parent groups. So the more we talk about it and the more questions you ask, the more we all learn about it and prevent those types of issues from happening.
Absolutely. Well, Dr. Bilkhu, thank you for fighting the good fight, keeping the children safe out there. I appreciate you being with us, and I hope that we can talk again soon. I know there's a lot of other topics regarding children's eye health, and we'd certainly love to talk about them. So thank you very much for being with us today, and we hope to talk again soon.
Yeah, thank you, Thomas. I appreciate it. And thank you, OCuTALK, for having me today.